Hello, everyone. So thank you very much for the opportunity to present our latest work in ODYSSEY. So what's the current evidence on the weight changes in HIV? So in adults, more weight gain on a new antiretroviral drug, such as Dolutegravir, Bictegravir, and TAF, have been reported in some adult clinical trials, observational studies, and clinical practice. So this has led to the perception that these new antiretrovirals actually lead to excessive weight gain. However, a recent comprehensive review of large clinical trials in adults has shown that weight changes are actually influenced by a complex interplay of HIV disease status, a number of environmental and host factors, and also treatment factors. In terms of treatment factors, the review showed that the Dolutegravir, Bictegravir, and TAF actually have a neutral effect on weight, whereas other antiretroviral drugs have a weight suppressive effect. So these include efavirenz, TDF, lopinavir, ritonavir, abacavir, and zidovudine. In children, particularly those starting ART or switching to effective ART, they are expected to have a high rate of weight gain. So this is the return to health weight gain. In those with a well-controlled HIV, are expected to continue gaining weight at a similar rates to their HIV-negative peers. And this is, of course, accounting for any known drug effects. So studies on dolutegravir-associated growth changes in children and adolescents, they are limited and somewhat conflicting. So whereas some studies have shown higher weight gain on dolutegravir compared to other regimens, other studies have shown no weight changes on dolutegravir or weight changes comparable before and after DTG start. So the ODYSSEY trial was a phase 3 non-inferiority trial comparing dolutegravir-based ART versus standard of care in children starting first-line ART or switching to second-line ART, aged 4 weeks to 17 years. So during the randomized phase, follow-up was until the last participant reached 96 weeks. And then the trial also had an extended follow-up phase, which added an additional 3 years of follow-up in Africa and Thailand. So most children in the standard of care arm actually switched to dolutegravir by end of the extended follow-up. So a weight change analysis over 192-week follow-up has been done, and the results were presented at last year's pediatric workshop. So this analysis showed that the dolutegravir-based treatment was not associated with excessive weight gain compared to standard of care over 192-week follow-up. So the aim of our work is to build on this work and evaluate the growth trajectories before and after switching to dolutegravir. In terms of methods, so we included participants with an enrollment weight of over 14 kilograms, so this is the main trial cohort, who were randomized to the standard of care arm, who later switched to the dolutegravir-based regimen during follow-up. In terms of growth data, so we used the BMI for age Z-score as a surrogate measurement for growth. We included participants with at least one BMI for age Z-score measurement in the 96 weeks before and after DTG switch. In terms of analysis, we used adjusted linear spline mix models. We estimated the mean change in the BMI for age Z-scores 96 weeks before and after DTG switch overall and across subgroups by demographics and characteristics of DTG switch. The data were censored at the earliest of DTG stop, last visit, or at censoring date. So this slide summarizes the characteristics at or prior to DTG switch. So we included a total of 239 children in our analysis. Just over 50% were male. Vast majority were Black African with a mother-to-child transmission. The median age at DTG switch was 15 years, and this ranged from 7 to 20 years. Median weight at DTG switch was 44 kilograms, and the vast majority of children were in healthy weight at DTG switch. Only 7% were overweight and none were obese at switch. 10% were in the thinness or severe thinness category. So the median BMI for age Z-score at DTG switch was minus 0.7. So very quick reminder, so in general, negative BMI for age Z-scores indicate that the BMI is below average for their age and sex within a reference population. The vast majority of children included in the analysis were virologically suppressed, with a viral load less than 400 copies per mil at switch. Most were on a Bacavir backbone just before switch, most on PI anchor drug before switch. So the overall median follow-up before DTG switch was 216 weeks, and after DTG switch, 81 weeks. So this graph shows us the estimated mean BMI for age trajectories 96 weeks before and after switch. So what we can see in here is that in the 96 weeks before switch, BMI for age Z-score was largely unchanged. However, after switch, BMI for age Z-scores had increased in the 96 weeks after switch, and the mean estimated increase was of 0.14. This is Z-score scale. So overall, we also did see similar proportions ever overweight or obese at any time in the 96 weeks before and after switch. So this plot summarizes the change by sex. So what we can see in here is that in females, the curve in red, we see the BMI Z-scores had increased significantly in the 96 weeks after switch, whereas in males, the blue curve, the Z-scores they were largely unchanged in the 96 weeks before switch, but it even decreased slightly in the 96 weeks after switch. This slide summarizes the changes by BMI for age Z-scores at DTG switch. So here we're looking at children with the lowest, so 4 groups. We have children at the lowest BMI for age Z-score of less than -1 group, between -1 and 0, and 0 to +1, and over +1. So what we can clearly see in here is that in children with BMI for age Z-score less than 1 at switch, the blue curve, BMI increased significantly after switch. And this is not what we see in the other groups where the BMI for age at switch was higher. This is a summary of changes by age at DTG switch. Here we're looking at children less than 10 years, 10 to 15, and over 15. So the BMI for age Z-scores in children over 15, the green curve at switch, had increased significantly in the 96 after switch. We did see similar proportions ever overweight and obese at switch in the 96 weeks before and after switch, which was reassuring. So this graph summarizes the changes now by backbone prior to switch. So we're looking at 4 groups. Group A were the children on a Bacavir prior to DTG switch who stayed on a Bacavir. B were children on a Bacavir prior to switch who switched to TDF post-switch. Then we have C were the children on TDF pre-switch who stayed on TDF. And then we have Group D, those on Zidovudine prior to switch, who then switched to TDF post-switch. What we can see in here is that the BMI for age Z-score in children on Zidovudine prior to switch, the green curve, had increased significantly 96 weeks after switch. The increase was sharpest in the 48 weeks after switch for children either on TDF or Zidovudine prior to switch. So in summary, so overall, we found that the BMI for age Z-score in children had increased after DTG switch, and children had moved toward average BMI for their age and sex within the reference population. So we saw an increase towards BMI Z-score of 0. Overall, we saw no significant increase in proportion ever overweight or obese after switch compared to before switch, which was reassuring. Finally, we think that our findings support the beneficial influence of DTG in children, particularly those with a BMI for age Z-score that's lowest, so less than -1 at switch. So we have quite a bit of future work to do. So in the future work, we are going to look at imputing missing BMI Z-scores for children over 19 years old, because in our current analysis, we use the WHO growth reference, which is restricted to 19-year-olds. In our current analysis, adjusted analysis included the main effects of covariates. So we will next account for the trajectories across covariates. We will further investigate backbone and/or anchor drug interactions, numbers permitting. And finally, we'll also examine factors associated with growth after DTG switch. And finally, I would like to thank all the ODYSSEY participants, investigators, trial management team, all the committees, sponsor, and funder. Thank you very much for listening.